Hi, I'm Dr. José Mayorga, faculty in the Department of Family Medicine, as well as the Executive Director here at UCI Family Health Centers in Santa Ana and Anaheim. I'm really excited to share some wonderful news with you on how UCI and UCI Health have responded to the COVID-19 pandemic, and also share with you some interesting insights how it's impacted a specific community, the Latino community. Before I get started, I want to share a little bit about myself. Growing up as a kid in Pomona, never my wildest dreams that I ever think I'd be here sharing my information with you, let alone being here as faculty member at UCI Health. As the only second person in my family to go to college at the time, I followed my sister's footsteps and came to UCI. I was then able to attend UCI School of Medicine and become trained in family medicine at Harbor UCLA, a county hospital system here in California. Again, I'm really excited to share some of this information with you, so why don't we go ahead and get started. It's really interesting, kind of the path I've taken since 2008 in finishing my training. I returned back to Orange County, and where I actually was first able to work for a small medical group known as Memorial Prompt Care. Soon thereafter, I opened up my own private practice in Costa Mesa, followed by working in nonprofit sector for Ultimate Health Services and Share Ourselves Corporation, both of which led me the opportunity to become a medical director, as well as a chief medical officer for a fairly qualified health center. Before arriving at UCI Health, I had the wonderful opportunity to become an IPA medical director. For healthcare partners, I oversaw the largest HMO practice here in Orange County that served over 130,000 patients. And I had to supervise over 400 primary care doctors and 900 specialists. Now, when the opportunity came to return to UCI Health, I really jumped at the opportunity to return to my alma mater, but more importantly, return to the clinics where I became really passionate about caring for the underserved. One common thread throughout my entire career so far has really been working for the underserved, and particularly the Latino community here in Orange County. And so it was never thought of that I would have to be leading such a unique group of individuals in caring for specific patients as they were being impacted for a once-in-a-lifetime pandemic. But I'm getting a little bit ahead of myself. Why don't we talk about the overall response UCI Health has had during this COVID-19 pandemic? As the only academic medical center and institution here in Orange County, it was no surprise that we were leading the efforts surrounding research. We mobilized quickly to research across all several UCI schools. In particular, there was an acceleration to ensure that we're making significant impact in the way we were caring for patients. The School of Medicine established a UCI joint research of $1.2 million and quickly was matched by a generous donor. Over 37 projects have been funded to date, and most recently, surrounding the COVID-19 vaccine, we have researchers looking at a universal vaccine designed to protect us against all forms of coronavirus, of which COVID-19 is a part of. And one of our researchers is working really diligently to try to make the delivery of vaccines a lot easier with using a skin patch. Now, what about being on the front lines? What about UCI Health's response? Well, let me take you back. Back in early 2019, UCI Health's pandemic planning had already begun. Let's not forget that there were other worrisome viruses out there, such as SARS and MERS that were arising. And we were already preparing for the potential risk of pandemic at that moment. It wasn't until December 2019 where we really started monitoring COVID-19 itself. And it was beginning of February that we really activated all of our efforts surrounding our response to this pandemic. We met regularly internally as an enterprise, but also we began convening regional preparedness calls with the rest of the OC healthcare leaders. We had to stand up quickly 3 testing sites for the entire county. We were the first to ever do that. We were the first to do the drive-through testing sites here in Orange County. In particular, some of our busiest testing sites, such as the one in Santa Ana, was really impacted and substantially producing lots of positivity rates, which I'll share a little bit later. In addition, while other hospitals were working diligently to stand up their own testing platforms, UCI was lending out their support to all the rest of the community hospitals in the area in supporting their testing efforts. Now, in the first phase and the first wave of this pandemic, we had to be very cognizant and mindful of our protective equipment, as well as trying to understand what was it about this infection that really was impacting so many at that time. We had to suspend certain surgeries. Of course, we had prioritization lists surrounding what types of surgeries we're able to continue to be performed, but we also had to be very mindful of our capacity to deliver health during this pandemic. We pivoted quickly in the outpatient setting to deliver telehealth services. So this is that virtual visit that many of you have heard about. We were able to start delivering care, particularly to many of our patients across the entire enterprise using either phone or virtual video visits. We erected numerous beds throughout our entire campus, and we were able to develop over 120 beds to support our efforts. Now, one of the most interesting efforts that we put forth was being the first of several hospitals in the county to set up a mobile field hospital. This hospital was established within a few days. It was put together by hundreds of volunteers who just worked day and night on weekends to try to bring together what we were able to establish right outside our parking lot from our main building. This first mobile field hospital was able to deal with the added surge capacity that was occurring within our hospital system. And while many people were preparing for their holiday season and their potential gatherings in a new way, we were busy trying to put together this hospital to be prepared for what we know to be the second surge, which was 2 to 3 times larger than the original one. Now, throughout this time, UCI Health has made a significant response. All hands were on deck and continue to be. We have all learned together to combat this pandemic because our primary concern was and continues to be the well-being of our entire community. Now, the game changer came once the vaccine rollouts began with both Moderna and Pfizer. UCI Health to date has vaccinated over 15,000 healthcare workers and teammates here at UCI Health. We're very proud of how quickly we were able to stand that up and being able to deliver that vaccine to add that level of protection to our staff. Now, as of the end of January, we have already vaccinated 10,000 patients. 10,000 UCI Health patients have already been vaccinated who meet the criteria set forth by the state. So this is a monumental time in our history to be able to quickly move through not only planning for the pandemic, treating the pandemic, and now preventing it. Now, our efforts and expertise has not gone unnoticed. Many businesses and organizations across the county have come to us for support and help, either by helping them with reopening strategies, mitigating their risks and exposures for their employees, and really offering other things such as testing and contact tracing guidance and establishing protocols. Our experts, our faculty have helped numerous other organizations across the county and even across this country and the world. Now, it was really important for UCI Health to be able to be transparent and share up-to-the-minute data, not only to what was expected from us at the state level, but very importantly, also on the ground. We wanted to give visibility to our teammates, what was happening day after day as we're managing through this pandemic. So we created dashboards to allow us to pivot, readjust, and reimagine how we delivered care during this time. Now, collectively as a group, all UCs have really put forth a strong effort to battling this pandemic. And as you can kind of see from the graph, we've had here in California 2 waves. We've had obviously the wave early in summer, but by no surprise, the second wave, the second surge was and has been the most significant. One of the things, unfortunately, throughout our state, we have seen a disproportionate amount of the community being impacted by this pandemic. And this is no different of what we've seen in our specific hospital systems across the UC. The impact that this pandemic has had on the Latinx, the Latino community has been enormous. It's a great lesson for us all to appreciate the healthcare disparities that exist throughout our entire country. And this is something I've shared consistently over the last year with many of our medical students and residents as we continue to battle and protect the most vulnerable in this county. Now, when you look at the national data, the data that the CDC has put together, Latinos compared to whites and other minority groups are really impacted. They're almost 2 times more the cases. They're 4 times likely to be admitted to the hospital, and unfortunately 3 times as likely to die from this infection. Now, most recently, when you look at the vaccine rollout and distribution, whites are 6 times more likely at this moment in time to be vaccinated compared to Latinos. So talk about disproportionate impact. We have to make a significant effort on how do we address this situation. Now, again, throughout the US, unfortunately, Latinos do live in several hotspots in the US. One of them, of course, being here in California, and specifically Southern California. Now, we like to take great pride, I'm assuming here in California, of being ranked very highly, but this is not a ranking we would like to be a part of. Unfortunately, 5 Southern California counties are in the top 10 of the counties across all the country of COVID-19 cases. Now, it shouldn't be any surprise that many Latinos live in these specific counties themselves. When you look at California particularly, again, there is a disproportionate group of individuals that are being impacted. Keep in mind, only 39% of the entire population in California are Latino, but they represent 55% of the cases of COVID-19 and 47% of its deaths. This is monumentally healthcare disparity in true form. And unfortunately, the death rates are substantially different amongst the Latino population versus other ethnic minority groups. Now, Orange County, unfortunately, holds true to the same trend. Latinos make up about 35% of the population, but yet 44% of the cases here in the county. 39% of its deaths are of Latino origin. And unfortunately, we need to continue to address the situation. Now, what about those highly impacted cities in Orange County? Well, what the county kind of deems as hot zones. Now, 20% of the OC population lives in 2 specific cities, Anaheim and Santa Ana. It is no surprise that the majority of the people living in these 2 cities are of Latin descent. And that's a big thing to really highlight at this point, because that is also where these 2 clinics that I help oversee serve the community. Now, as you take a deeper look at the communities in these 2 cities, there's an obvious socioeconomic disadvantaged presence amongst these 2 cities. They're densely populated. There are obviously living constraints surrounding the people living in these homes, as well as there's numerous essential workers that reside in both these cities. Now, let's talk about living constraints for a second. Many of our patients and many of our community members that live in small apartments or small homes, multi-generational people living in small confines. So if one of them gets diagnosed with COVID, it's very challenging for them to socially distance and isolate that individual from the rest of the household. So you could imagine why it's such a huge piece of us to try to understand how do we protect this community while making sure that they're able to live within their confines and within their means. Now, we have heard of the medical conditions that put everyone at increased risk of complications and even death from COVID-19. But I'm here to tell you that the social determinants of health play such a larger impact of how we are succumbing to this COVID-19. Unfortunately, social determinants of health are directly linked with poor social conditions and directly linked with having worse diseases and worse outcomes. What are social determinants of health? Well, they're the conditions and the places where people live, learn, work, and play that affect a wider range of risk and outcomes. Now, I mentioned earlier that the people that live in these 2 cities in Santa Ana and Anaheim are essential workers. They truly are. They're food industry workers. They work in fast foods. They work in the supermarkets. They may work as janitorial or housekeeping. They live and work in environments that don't allow them to work remotely. As a matter of fact, the U.S. Bureau of Labor Statistics has shared that only 16% of the Latino community can work from home. So while the rest of the county may have opportunities to work remotely, this community does not have that opportunity. Furthermore, they work in positions that are lower paying jobs and may not have all the benefits surrounding them. So they have to choose to work and they have to provide for their families in order to keep a roof over their heads. So how have we responded to caring for this unique population? I shared earlier how we've been taking care of the population at the hospital level, but how we've responded specifically in caring for the Latino community who has been dramatically impacted by this pandemic. The two sites I oversee are very unique. There are federally qualified health centers, also known as community health centers, here in the city of Santa Ana and Anaheim. They're the oldest FQHCs in the entire county, established back in 1985. As a matter of fact, the Anaheim location has been serving the community since 1977. It's the oldest of all the clinics here in UCI Health. And so these two sites serve just under 24,000 people a year. Predominantly, those individuals we serve are of Latino descent and range from 0 to 99 plus. So it's absolutely imperative that we address the needs of our community and ensure that we were able to take care of them. Now, you may probably think all we do in these sites is medical care, but the reality is we offer more services, more needed services for them. Not only do we provide medical health, medical care, we also provide oral health via our dentistry clinic. We provide social services as well as behavioral health services, all wrapped around to ensure that the most needed community has the resources to be well cared for. Now, our efforts are nationally recognized by the federal government, who's awarded us many accolades across various phases of our ability to care for this community. And in particular, this is really important because in the end, we were able to respond to care for those 24,000 individuals. So what did we do? Well, it was apparent that we needed to make sure we provided care, and specifically in a unique way. But of course, we stood up our own drive-through testing site. Back in the first wave, about mid-July, the positivity rate at our drive-through site was at 37%. This second wave, the week of December 28th, it peaked at 58%. That is a substantial amount of individuals impacted by this pandemic. And so throughout this pandemic, our clinic has evolved, adapted, created, and really pivoted on how we care for patients. So we definitely converted into virtual care to ensure people were safe, continued to provide primary care, both preventative care as well as chronic disease management. We were certain to develop all sorts of materials that were culturally and linguistically sensitive to the population we served. We used special technology to ensure that we were able to manage our patients proactively and also identify the highest risk patients so that we could mail order their medications to them and avoid them from coming into our clinics if they did not have to. Now, if people did come in to be seen, such as our pregnant patients, we ensured that they stayed safe. Of course, we implemented all the safety and cleaning standards that we needed to, but also we ensured that patients had communication with us remotely to ensure that they would come into our building only when we were ready to provide them care. Now, given our population, a large number of our population suffer from anxiety and depression. Even though several of them have been well managed, we knew and still know that this pandemic is impacting them. And so we proactively reached out to all of our patients who have anxiety and depression and ensured that our social workers connected with them to see if they were having any challenges. Now, I mentioned social workers. Our social workers are really unique. Not only do they provide counseling for our behavioral health, but also they were identifying resources for our patients who uniquely are being challenged during this pandemic. And so they were finding things to allow them to find rent assistance, as well as ensuring that they had healthy food resources to maintain their way of life. And lastly, you should be surprised, We can provide virtual dentistry, and that's what we just did here at our FQHC. We were providing dental care virtually and ensuring patients were evaluated closely. And if they did need a little bit further intervention, of course, we made the efforts in a very safe and secure manner to provide that care. Now, as I mentioned earlier, the vaccine has made a huge step forward in battling this pandemic and hopefully coming to an end. And I mentioned earlier that many of our patients, specifically the Latino community, have not had the right access to vaccinations. Now, we talk about vaccine hesitancy, and yes, that is also a major concern. And so when we rolled out our vaccine efforts, this is a grassroots effort of education for our patients so that they could understand why it's safe, why it's necessary, and how we will give them that vaccine. And so all of this education outreach is really to hopefully prevent them from succumbing to this pandemic. Now, all these efforts couldn't have been done without a little bit of extra help here in our clinics. Thankfully, our School of Medicine students were really proactive, and many of them lent a hand specifically translating materials that we created in English of COVID-19. Particularly, our students in the Program in Medical Education for the Latino Community, also known as PRIME-LC, not only translated those materials, but also created instructional videos in Spanish. They supported other federally qualified health centers here in Orange County and did a lot of telephone outreach to ensure that patients were actively seeing their providers in some shape or form, be it in person or virtual. Now, other ways that we really stepped forward to ensure that the Latino community was getting addressed in this pandemic was the efforts set forth by the Program in Public Health under the leadership of Dean Bowden Albala. They created a collaboration with community-based organizations that are well known and trusted. They trained these contract tracers to provide culturally sensitive information to the most needed communities hit hard by this pandemic. Furthermore, they also were first in the entire state to do a prevalence study of COVID-19. And unfortunately, to no surprise, the vast majority of the folks being impacted were lower income and Latino residents here in Orange County. Now, all these efforts, all of this energy has really shared something really unique to me. The pandemic will impact us all. It has also exposed significant disparities across our communities. But fortunately, some will be more affected than others. UCI has responded to the care of these communities and the entire county. We are leading the way to recovery and reimagining how to deliver health to our community and the world. We hope to continue to keep forging ahead and reaching to the clouds to ensure that everyone is well cared for. It's been a great pleasure to being here with you all today. I'm honored to have been able to share how much effort UCI Health has been able to set forth during this pandemic and respond to it, while also making sure we care for all of our community, especially those most impacted. Thank you, and have a wonderful rest of your day.